So plantar fasciitis is probably one of the more common things that I see. The plantar fascia is a big, thick ligament on the bottom of the foot that attaches the heel to the base of the toes. And it basically is there as a check ring to prevent the arch from getting longer or collapsing. And so plantar fasciitis is when the fascia is inflamed. And so the cause of the inflammation is the arch being driven down by an imbalance of the musculature in the back of your leg. There's two muscles that make up the Achilles tendon, and those tendons merge together to create the Achilles tendon. And so when there's a tension imbalance between one of those, it wants to overload the front of your foot and force a arch collapse very gradually over time. And as the arch is being driven down, that plantar fascia is being stretched. When patients present with symptoms consistent with plantar fasciitis, it almost always involves pain with their first few steps out of bed in the morning. In addition, if patients are walking throughout the day and they get home from a long day at work and they go to sit down, when they go to get back up, they typically note searing pain on the bottom of the heel that's quite limiting. When they first get up in the morning, they'll have that discomfort that kind of eases up a little bit, and then again can get worse as the day progresses. But those are kind of the hallmarks of plantar fascial symptoms that patients present with. And so typically we start with aggressive calf stretching, trying to stretch that calf muscle that's a little bit too tight. If that fails, we can try to augment with a night splint, where you're wearing something at night to try to help hold the ankle in a stretched out position. And then stretching during the day. We could try to immobilize you in a boot to try to let things calm down. We do injections. I typically don't do a lot of those as it's not a fix, it's more of a Band-Aid. And so if somebody has an event coming up that they want to go on vacation, or they've got a wedding or some kind of special function, we can do those, and they can absolutely provide some temporary relief, but they will not fix anything. If we run through all of our conservative options and patients have failed conservative care and we're convinced that it's plantar fasciitis and not another cause of heel pain, I typically will recommend a simple little calf lengthening procedure. It's outpatient, it takes 2 to 3 minutes to accomplish that. Patients will be put into a boot when they wake up. They wear the boot for 2 weeks. We see them back in the office at 2 weeks to make sure that small incision is healed, and then we'll send them to therapy. So there's not a lot of recovery, and it's fairly successful in treating plantar fascial pain that has not responded to conservative care.